Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live for you from the Dolph Simons Jr. Family Broadcast Studio. Delighted to be back with you on this cloudy, but just a little cool Monday morning. A little relief from the heat. Doesn't feel bad. We've been getting a little bit of relief throughout the last few months with COVID, which has been terrific. And today we have a great lineup of guests who are going to help us even more with that conversation. A teen panel of folks who made the choice to get vaccinated. We're going to learn more about their reasons for getting vaccinated and how they're feeling about that, the side effects of the vaccine, all the good stories. I can't wait to talk to these people. It looks like an outstanding program. We're also going to hear about virtual learning that resulted from COVID-19 and how that impacted their learning. But first, Doc Hawk, how did we do over the weekend?
Yeah, you know, Hays has 2 active infections. We here at the health system, we have seen kind of this past week to 10 days that our active numbers have been in that high teens, essentially. Unfortunately, we had a little bit of a dip on Friday. I was optimistic, but today we have 17 active infections with 2 in the ICU, 1 on the ventilator, and still 7 in that recovery period.
So we know the relative percentages of people in our area who have been vaccinated.
Yeah.
Given that, this feels like without masks, with people baying out in the bars and restaurants, et cetera, that this is the number we're going to see for a while. What do you think?
I think you're absolutely right, and I think this will continue until a lot of those people get vaccinated. We do understand and know that especially the healthy patients that are in here for our active infections are unvaccinated. So until those healthy patients get vaccinated, those eligible patients get vaccinated, this is probably what we are going to see. We know that the vaccinations offer good, robust, durable immunity even for those prevalent circulating variants right now. And right now, mostly it's the Alpha, the UK variant, and the Delta, the Indian variant. And the Delta variant is actually, increasing in prevalence as well. So we know that the way to get protection is through vaccination.
So should we be more concerned about that Delta variant than the Alpha variant?
I think right now with the velocity of the change of the prevalence, meaning it is becoming, I think the last statistics we saw was it was doubling every 10 or 11 days, the prevalence. I think we need to be doing that. There was always concern, well, does this cause more severe disease? Does this variant cause it more than the original the virus that was going around, or this variant more than that variant? We don't have that information right now. We certainly know that that was a thought for the Alpha variant early on in the UK. But again, the Lancet paper came out and said, it doesn't cause necessarily more severe disease. Those things are being investigated with every variant. So, that question is unanswered right now. But even so, protection against it is offered by the vaccine.
So darn important, isn't it? Well, before we jump into our conversation, are there any reporter questions today?
I have none.
All right, then let's get into this conversation with some pretty cool young folks. Because I think, Hawk, if we're going to really get a control of this, it's really young people are going to have to help carry the day now, because we've got to make sure they get vaccinated.
100%. We're taking our numbers about vaccinated population, and that's because of the eligible population. And right now in the United States, that is everybody 12 and over. And we know that for every person vaccinated, that takes one more susceptible person out of the pool to be infected. And we know that it can affect children as well, young people as well, long COVID symptoms, multi-system inflammatory disorder. So this is great that we can have these young people getting vaccinated.
It is outstanding. We've talked many times on this program about the need for students to be in the classroom, to feel safe, to enjoy social interaction, and to be part of their community, and, of course, keep the grades up. Not that I'm a parent or whatever think of anything like that. Now let's hear what some students at Ruskin High School and other schools are saying about virtual learning.
The social interaction between my teacher and me, it helps me. They can help me right there, and I don't have to wait for email or, worry if they seen it or not.
Being virtual, it just changed a lot. Like, I really wasn't paying attention as much, and I wasn't listening as much, and it actually showed in my grades.
It was smooth sailing. I had good grades. I was looking good for graduation, and then COVID hit, and my grades dramatically changed. I couldn't go to class on time because I have insomnia, so that really messed with me.
felt great because I love school. Like, I love being in the building and being with people.
Not gonna lie, I was happy. I'm a social person. I love being interactive.
I knew our teachers was going to do a lot with their masks, make sure we have our mask on, hand sanitizer, wiping down our desk. I knew all that was going to happen.
But being able to actually get out of bed, get ready for school, it's kept me more awake. I'm not a very social person, but just a little bit goes a long way.
Get life back to normal, but still safe.
I hope I get the rest of my years of high school with sports and just whatever comes along.
All right, well, we know the vaccine is our way to help keep kids back in school and keep our community safe, and we are looking forward to this conversation because our guests today are teenagers and one preteen who made the decision to get the COVID-19 vaccine. Some are children of health system employees, some are not. I'll introduce them all, and then we'll start our discussion. Now, guys, if I get your name right, I expect a thumbs up. If I mess with it, just give me the kind of sign that says, okay, you made a good college try here. Okay, Alice McConnell Curry, daughter of Sean Curry. Got that one right? Dylan Markey, close? All right, thank you, Dylan. Thanks for being here with us today. Josiah Stewart and his dad, Joe. Josiah, did I say that right? All right. Ashlyn Goldsberry, daughter of Vanessa, right? Okay, and here's the hard one. Natalia Castillejos-Ramirez. How was that, Natalia?
All right.
All right, I got it. Yeah, listen, I flunked English, so I'm challenged by any other kind of anything else. And her mom, Mariana. All right, welcome and congratulations to all of you on getting vaccinated. I have questions I want to ask each of you, and I'm just going to go. I'm going to start with each person. I'm going to go through that. I'm going to ask questions to you, and you guys just tell me what you think. So first, I want to start with Alice. So Alice, how old are you?
I'm 16.
16 or 60? 16. Okay, good. I see Dad sitting there. I'm going to assume he's 6 years old. I'm just kidding there. All right. So now, where do you go to school, Alice?
I go to Moore Hill. It's in Atchison.
All right. So a little bit, not truly rural, but a little bit more, right, than the main part of Kansas City. So when and where did you get the vaccine?
I got it at the Hy-Vee in St. Joe in April.
Okay. Did you have any? Was that hard to do? I mean, did you feel good about it? Tell us a little bit about that.
My dad scheduled the appointment for me. He just found an appointment online, and then it's like 30 minutes away from our house, so we just drove there, and I got vaccinated.
I love that. Dads of America standing up, making sure their kids get vaccinated. Well done, Dad. I would have done the exact same thing. Or my wife may have actually scheduled it. She's a better scheduler than I am. So tell me a little bit about why did you decide to go ahead and get the vaccine?
My whole family's vaccinated, basically, and I thought it was a good idea. I wanted to be able to see my family again and kind of get back to normal and have a sense of security and stuff. So, yeah.
Cool. And did you have any side effects?
Nope.
Awesome. And you've had both shots? Which vaccine did you get?
Pfizer.
Pfizer. Okay. Very cool. And have you talked about that with your friends? Have you tried to talk anybody else into getting the vaccine?
Yeah, a couple of my friends got vaccinated around like the same time I did, and I know a couple more of my friends want to. So, yeah.
All right, so keep talking to them about it. Remember, be the Force. Well done here. Okay, that's a Star Wars reference, not Star Trek. Don't worry, I'll take care of you Star Trekkies out there. All right, let's talk next to Dylan Markey. Yeah. Dylan, you there?
Yeah, hey.
All right, Dylan, you got vaccinated. So how old are you?
I am 15.
15, okay. You're a young man. You're not driving yet, right?
I'm actually driving a little.
You got a learner's permit. Or are you just driving without a permit? Is that what's going on? Not that you have to tell your true confessions here. Okay, so where do you go to school, Dylan?
I go to the Barstow School.
Barstow, okay. And where and when did you get the vaccine, Dylan?
I got it at KU, and I got my second shot on June 7th.
All right. So recently, and Pfizer or Moderna?
Pfizer.
Okay, man, we got 2 Pfizers so far. And how have you been feeling?
I've been feeling great.
Good.
After the first shot, my arm was just a little bit sore, and after the second, I just felt like a little bit tired, but that was it.
Awesome. So have you been trying to talk other people into getting the vaccine?
Yeah, well, I've been talking to my friends, and I'd say about like 90% of them have been getting vaccinated, have gotten like at least the first shot. So I've been trying to like encourage them to get the shot.
Well, that is really awesome. Good job. So tell me, why did you decide to go ahead and get it?
Well, I wanted to feel protected because I do some extracurricular activities, and like I play some sports, and I want to feel protected when I'm around them. And I also want the people around me to be protected, like so I can hang out with some of my older family members and friends and stuff like that.
That sounds really awesome. And so I'm all about that. That's well, not that I wanted to play extracurricular sports because I'm maybe a little too old to do that now, but I like to go out and do stuff and watch other people play sports. So it made it a lot more, it made it a lot of fun, a lot better, able to go do those things. Who is your biggest influencer in getting the vaccine?
I would have to say my parents were, because they got the vaccine pretty early. And they felt really good about getting it. They felt safe and secure. So it made me feel like if I got the vaccine, I would feel safe and secure.
All right.
So,
and as well you should. And have you had any side effects?
No, not really.
All right. And has this allowed you to get a little bit more back to normal?
Definitely.
Awesome. All right. Remember, be the force. Okay, I'm going to end each of these with be the force. You'll probably catch a pattern here. Josiah Stewart from Park Hill and your dad, Joe Stewart. Josiah, talk to us a little bit. How old are you?
I'm 17.
17. Okay. Josiah, where do you go to school?
Park Hill South.
South. What do you think about Park Hill North?
We don't talk about them too much.
That's the rival.
That's the right. I went to Truman High School, Independence, Missouri. We never talked about William Grossman. All right, Josiah, tell me a little bit. Where did you get the vaccine? When did you get it?
I got it in May, and I got it at our St. Luke's.
Oh, where? St. Luke's. No, those are
right.
good. They're good folks. No worries. I just messing with you. So, which vaccine did you get? Pfizer, or Moderna?
I got Pfizer.
Man, 3-0 on Pfizer. What's that? Pfizer's way ahead here. Okay. So, how did you feel after you got vaccinated?
I felt good, other than some soreness in my arm, and then after the second one, just some fatigue. I was feeling great.
All right. And and I see your dad sitting there next to you. Was he a help in getting this vaccine? Did he influence you?
Yeah, you could say that he did. Kind of early, and he made sure to let me know that he felt good about it and that I should get it.
All right, to you and all our dads who are listening, to Joe Stewart and to all the dads and who are here today and et cetera, happy Father's Day, one day late, but well done, dads, making those kids get the vaccine. Right choice. Help protect them from all the bad things we actually talked about earlier in the program. So have you had any side effects from that, Josiah?
Not really. I felt pretty good, just healthy and not anything bad.
All right, so have you used the force and gotten other teenage friends to help or to get them vaccinated?
I have talked to a few of my friends to let them know that you may feel okay without getting the vaccine, but you feel a lot better and more protected if you do get the vaccine, and there's nothing to be worried about. It's a great choice, and the friends that I had told that to, they've either got their first one or got fully vaccinated.
Outstanding. Be the force. Well done. And tell us a little bit. You said you didn't really have any side effects or anything, but do you feel like you can get back out into society and be safe now? Is it more fun? You're a little more relaxed?
Most definitely. I can definitely say that I can now go out with friends and not feel like I have to wear a mask all the time around them. I still do wear one occasionally when I feel like I need to, but I feel more safe. It feels more normal than what we were used to.
Yeah, that's outstanding. Well chosen. And are you involved in extracurricular activities here as well?
I was before COVID. I went in downtown Kansas City. I boxed, but I no longer do that.
Okay. Well, I'll make sure I don't get in an argument with you. How about your dad? Does he ever argue with you about stuff now? So, Josiah, no, I was just messing around, asking if your dad would mess with you since you're a boxer. I would probably tend to avoid those things. But congratulations and thanks for being on the program. Thanks for using the force. Keep it up and convince others to do the same thing. I'm going to turn to Ashlyn Goldsberry. Ashlyn, how old are you? Where do you go to school?
I'm 17 and I go to St. James Academy in Lenexa.
All right. So St. James has become this kind of soccer powerhouse and other things, right? Isn't that kind of the St. James way down there?
Yeah, my freshman year we won state, but this year we had a good run, but we weren't lucky enough to get to the finals.
Okay. So tell me, why did you get vaccinated?
I got vaccinated because I knew that it would keep myself healthy as well as my grandparents because we're really close to them. And I just knew that it was a step closer back to normalcy.
Yeah, that certainly is true. It is a step closer back to normalcy, no question about it. Where did you get vaccinated and which vaccine did you get?
I got Pfizer, and I was vaccinated at the KU Med main campus downtown.
Yeah, okay. I like these KU things, rock chalk. And, yeah, and of course, everybody's getting Pfizer because that's the one that's approved. I was just trying to mess around with that a little bit earlier. So, it's 504 or whatever. So, okay, so how did you feel after the vaccine? Side effects, et cetera?
So a few days after I got my second dose, I had like really bad body aches, but after that, I've never had like any side effects afterwards, and I feel 100% fine and healthy.
Okay, I'm right there with you on the body aches after the second dose. Same here. But it goes away pretty darn fast. Have you been using your experience to help influence others that you know to become vaccinated?
Yeah, so I had talked to a lot of my friends, just kind of telling them like how my symptoms were and just a little bit more information on like where you can go get vaccinated. And a lot of them after I got vaccinated definitely got their first and second shots, and they didn't really have any side effects either. And they definitely said that they were glad they got it too.
All right. Well, that's outstanding. So what do you like to do at school?
I play soccer, and then I'm just involved with a few other clubs like inside of St. James, like some service clubs.
Yeah, well done. So you really did know about that soccer run, huh? All right. Well, thank you for being on our program. Well done getting the vaccination. I so appreciate that. Great choice. And remember, be the force. All right. Now, Natalia. Did I say it right first?
Yeah.
Pretty good, huh? All right. And then I'm going to say Castillejos-Ramirez. How close was I?
Ramirez was actually good. He was close.
Close. You're very kind. So let me hear you say your your full name.
Natalia Castillejos-Ramirez.
Okay, yeah, I'm not going to be able to do that. So you did. So I'll just leave that to you. I'm just going to say Natalia. So so tell us about you're getting vaccinated. How old are you?
I'm 12.
You are a youngster here.
Yeah.
Awesome. Congratulations on getting the vaccine. Well done. When and where did you get it?
I got it May 13th, and I got it at the Johnson County Health Center.
Outstanding. They've done a great job there at getting people vaccinated. So tell us a little bit, why did you get vaccinated?
I got vaccinated because most of my family was already vaccinated, and I wanted to do the things that they were doing. I also wanted for people that have weak immune systems to feel safer, so I got vaccinated.
Well done. I think you made a great choice, young lady. That's awesome. So, any side effects from it?
During the second doses, my arm hurt, and I was a little tired.
Yeah, I'm gonna say yes about that tired part myself. Tired and achy, but it goes away pretty fast. How do you feel now about that? Are you doing okay?
Yeah, I'm perfectly fine.
Good. And have you been able to talk any of your friends into getting vaccinated?
Well, I've told some of my friends about getting vaccinated, but it's not them that I've been trying to convince. It's more their parents, because for them it's not a problem to get vaccinated.
Wise beyond your years. Well said, Natalia. That is exactly right. Oftentimes it is the parents that we have to talk into letting their kids get vaccinated. So well done. Any success so far?
One friend got vaccinated.
I'll take that. That's a good. You know what? One by one. That's how we do it, right? Row by row, inch by inch. Going to make my garden grow. There you go. All right. Well, that's outstanding. Good job. So, guys, and so, Natalia, what am I going to say next? Be the force. That's right. That's right. You will be vaccinated. Oh, wait a minute. I'm waving the live long and prosper sign for Star Trek. There you go. All right, guys. I have one other question for all of you. If one of you have just chime in here, have any of you had COVID? No, but do you know anybody that's had COVID-19? Yes. Okay. So I'll start. Josiah, people sick?
Well, I had a few sisters who had COVID.
Okay. How did they do with it?
Well, it was people who was the siblings that didn't have the vaccine, so they kind of just dealt with it. Thank God that it wasn't like severe where they had to be in the hospital. They just had to be
quarantined.
To see how they were feeling after it.
All right, Ashlyn, I saw you shake your head. Yes. Did you have some relatives or people you knew had COVID?
Say that one more time.
I switched to Ashlyn here. Okay. Ashlyn, did I see you shake your head? Yes.
Yes.
And how did they do with the COVID-19?
I don't even think they knew they had it until they got tested. They said one of my friends got tested randomly and it came back positive, and she didn't even have any side effects. So she was like, "Oh, I guess I had COVID and I didn't even know it." Mm-hmm. But she wasn't vaccinated when she got it, but she's vaccinated now. And
good choice.
Yeah.
Anybody else? Alice or Dylan or anybody else up there? Do you know anybody had COVID? Natalia? Yeah. How'd they do? Dylan had to folks you know do.
Well, as Ashlyn said, it was basically the same thing. My friends, they barely knew they even had it. They got tested and found out they had it, so they just quarantined. They quarantined for 2 weeks, and yeah, it was not severe at all.
Good. Natalia, did I see you shake your head yes as well?
Yes.
And how did people do?
Well, it was my deacon at church, and I think he did fine. He wasn't around for a couple weeks because he wasn't feeling well, but he didn't have to go to the hospital.
Good. Okay. And then Alice, did I see you? Did I have that? Wait a minute. No. Yes, Alice. How did the folk? You knew somebody who said thought they had COVID too. Is that right?
Yeah, a couple of people at my school got it. My school priest got it. A couple of my teachers. So yeah.
And how'd they do?
All of them ended up being fine, but yeah.
Okay. And the key is, and the reason that we want young people vaccinated is not only to protect yourselves, but to protect the older folks and especially grandparents and those wait a minute, that's my age, over 55 or 60, because they're the ones who could have the worst outcomes. So I want to say thanks to each of you for being vaccinated. That is an outstanding choice. All right, let's see what questions might be out there. We might have, I want to ask you guys one more question. Virtual learning, how was that, Alice? How'd you like the virtual learning?
My school had in person all of this school year because I go to a school of less than 200 people. So, yeah, we had in person. We only had to go online for like a couple of days when we had sort of an outbreak at school. But then we had fall break and everyone came back, and it was mostly fine for the whole year. So.
Dylan, how about you? Virtual learning?
Well, we also had in person most of the year, but a couple of days they would make them in virtual days, so the teachers as well as the students can get used to the technology and the Zooming and the difficult process of that.
Okay. Josiah, how about up at Park Hill? How did you have to do virtual learning?
Yeah, they gave you a choice. So I chose to do online. And when I was doing online, it was easier learning for me. I could get my work done faster, and I didn't have to spend 8 hours in a school. But the difficulty came whenever I had like questions about the work, and my teachers were split, so they were doing online and in person. So they couldn't answer my emails whenever I needed them to, and the grades weren't getting updated, but it all worked out in the end.
Okay. Thank you. Ashlyn, how was your experience with virtual learning?
Yeah, kind of like how Dylan and Alice said, I was pretty much in school the whole year. St. James had a really good process where if you tested positive, you'd be in quarantine for 2 weeks, and then all the kids who were healthy and didn't have COVID, you would be in the school 6 feet apart with masks on. And each Wednesday every week, they would do like a school cleaning, so then we would be online. And I just felt that process had like really helped us move forward, and there really weren't many like school outbreaks that I felt were in school.
Okay. Natalia? And Natalia, I don't think I asked where you went to school. Where do you go to school?
I go to Monticello Trails Middle School.
Okay. And did y'all do virtual learning?
Yes. Well, no, it was an option, but I did.
Okay. All right. So lots of different experiences in here, a fascinating group. So that's awesome. All right, guys, we're going to turn to questions now from our audience. I so appreciate your helping me with these important questions, and I so appreciate, as Hawkeye, we all do, having you tell your story about being vaccinated. Remember to keep using the force. And there may be some questions I'm going to turn to you, so stay sharp here. Okay, here we go.
Actually, the first question is for the group and the panel, and they specifically want to hear from parents. Lee wants to know, parents, now that your kids are vaccinated, are you allowing them to expand their bubble? And do you ask if the kids coming into your home have been vaccinated?
All right, let's first start with Joe Stewart. Joe, are you doing that?
Yes, it's James Stewart.
James Stewart, sorry about that.
Yes, I am. That's okay, no problem. Yes, I'm still concerned of protecting as much as we know.
Okay. And then let's talk to one of our other dads up here. Let's see.
Sean.
Sean. There it is. Sean Curry. There we go. How are you handling this with your daughter?
Everybody in the family is vaccinated, and so I feel pretty safe. We do still take precautions sometimes, but like we've been to Sporting KC games outside, and so pretty much whatever the kind of health department guidance is, and feel really good that we're protected, but also I'm probably feeling a little bit better because at first we were concerned, or I was concerned that maybe you would get it and pass it on, even though we were protected. It seems like that's, from watching this show and other shows, that's probably not as likely. So, I mean, still trying to be careful but not feel good and have expanded our bubbles for sure. And Alice is going to see her grandmother this week. So it's, who's vaccinated also. So I think it's just, definitely we've expanded and kind of followed what the health department guidance was.
Okay.
Are they allowing people in their homes that are unvaccinated?
Let's see. Are you guys, James, are you allowing people into your homes if they've been vaccinated or if they've not? How are you differentiating those two things?
Well, as much as I possibly can. I don't ask them, of course, to show me whether they're vaccinated or not. But I do kind of, protect the family.
Okay. Mariana, are you? Is your mom there, Natalia?
Yeah.
Hi, Mom. Oh my gosh, there's a mother-daughter resemblance there working. All right. So, are you keeping people in your house, or how are you doing with the vaccination? And do you let people in your house who have or haven't been vaccinated? How do y'all do it?
Yeah, so we're very lucky in which our close friends and family members, everybody's vaccinated. So we don't have an issue there. Yeah. Everybody is welcome to our home.
That's awesome. That is so good a feeling to get people back, isn't it? And have to not worry about that. Ashlyn, how about with your mom, Vanessa, there? How are you guys doing things at your house, Vanessa?
Yeah, we know that the vaccines work and we know that they're safe. So we allow friends and family into our home because all of us in our home are vaccinated and most of our family and friends are vaccinated. So we feel very comfortable.
All right. I like that answer. V for vaccination, live long and prosper.
Yep.
All right. Well, we got Jill.
Okay, so Cindy has a question, and it kind of dovetails really nicely with the question that we got from Jean on Friday that I said I was going to wait because it was going to open up maybe a discussion. Cindy wants to know, can you please talk about the surge in Southwest Missouri? There's 79 COVID-19 patients at Cox Health in Springfield, according to their 6/18 release. And Jean said on the NHS website, which is in the UK, they were predicting that we here are going to see a surge in patients. And they want to know, is that's what's happening in Southwest Missouri? Are we going to see a surge here?
Yeah. What do you think, Hawkeye? I think a lot of it's just kind of we're going to see outbreaks in areas where there aren't a lot of vaccinated folks.
Yeah, I think that's the bottom line is it's about vaccine uptake and what is that protection, that level of protection, the amount of people that have been vaccinated in your particular area. We know that vaccination has been a little bit lower uptake in those rural communities, not only Cox Health, but I think that the other organization down in Springfield too is having a lot of inpatients as well, from what I understand from people that work down there. So overall, that area, and it's not just that area, but it's other rural areas as well that are being particularly hard hit, and we've heard about those stories here over the past couple weeks.
Yeah, St. John's and Mercy or Cox are both being hit by the same sort of question. And I think when people don't mask and they're not vaccinated is when they're vulnerable.
Yeah, exactly. And we know that vaccinations can protect you, especially against these prevalent variants that are going around. And things are opening up more, and people are interacting more. And so you do that, and that leads to just more spread. But we can combat that by continuing to endorse vaccination and getting vaccine uptake.
So last week, I took a trip, and I was out in Southwest Missouri, actually South Central Missouri, went down to one of my favorite places on earth, River Life Farm, around Dora, Missouri, but nobody knows what that is. But it's kind of close to West Plainville. Dora, that's good. You worked there. And it was beautiful because it did feel like a step back in time. Nobody was masking, but nobody was sick. And, nobody's masking here now. I came back to Kansas City. We ran to Price Chopper last night. You had to get some kitty litter, and nobody's masking. I mean, everybody feels like we're getting back to normal. But if that's okay to do when you're safe, because when you're safe is when you're vaccinated. When you're not vaccinated is when you see the numbers start to rise again, because people start getting together indoors and outdoors. I mean, we were mostly outdoors, but when you're indoors, holy cow, that's when you can still shed the virus.
Yeah, I mean, I think you have to understand that when you do go to those places and you see people that are unmasked, you have to assume that not 100% of people are vaccinated. And just like James said, you're not asking everybody, but you have to do those things to protect yourself as well, because the virus is out there, it is spreading. You may be protected and vaccinated, so just understand those risks of whenever you're doing any of those interactions.
Yeah, just remember when you're indoors, you're really at a shed and spread. Okay, that was pretty good. Shed and spread. I want to see a little love on that one there, teens. Shed and spread, not bad. You're inside, you're at the shed and spread, but if you're outside, you can shed, but you don't spread. That's pretty good for an old man.
All right.
Okay.
Yeah, so the next three questions have to do with shed and spread, or to not shed and spread.
There we go.
Or maybe shed but not spread. Isaac said that Wednesday marks 2 months since he will be fully vaccinated. He's going to the sporting game that night, and he wants to know, am I safe?
I think he's safe.
Yeah,
Let's go sporting.
Safe. Yeah, I mean, and again, we've always endorsed being outdoors and doing those things. 2 months from being fully vaccinated, you're safe.
I tell you what, Royals games.
Enjoy it.
That's right. Sporting, go enjoy it. Chiefs, I'll probably be full throttle when I'm back at Arrowhead Stadium. Just saying.
Karen says, I am fully vaccinated and am traveling to visit family with unvaccinated children. 4 days of being outside and inside, including table games. Am I considered safe?
Well, that's a great question too, Hawk. I mean, it's a little harder if they're vaccinated and the kids haven't been.
Yeah.
But the likelihood is if you're vaccinated, you may get it from one of your kids, but you're probably not going to get real sick.
Yeah, I mean, I think the key component is, are you the individual vaccinated? If yes, then that's good. If you're going to visit other people, or other people in that household vaccinated, we have seen a recent paper that came out and said that, yeah, the overall risk of household contacts getting the virus, if other people are vaccinated, is lower. So you do get some protection from those other people in that household that are vaccinated. And if you can understand that, you understand that your risk is lower than if some people in that household are vaccinated.
I'd encourage people to be vaccinated before they get there. But right, we know you're probably not going to get as sick, but if you get it, you may still share it, although not as much as if you had not been vaccinated.
Yeah.
Okay, and I'll probably butcher this name, but Selfish wants to know, my children ages 7 and 10 are not eligible for vaccine, yet our district is not requiring masks this next school year, and our district staff are only 60% vaccinated. Will they be safe if they wear masks? Should I ask for social distancing class seating for them?
For the 7 and 10-year-old, yeah. That's a trickier question. We know that young kids tend to do pretty well with the virus. They can still shed it and spread it to somebody else. And the school teachers are the ones who really, I think, in that situation hold the risk if they're only 60% vaccinated.
Yep.
If you guys are vaccinated, or if you guys are back home or vaccinated, then your kids are probably not going to make you sick when they come back home. So I think you're probably in a reasonable position.
Yeah.
Obviously, wearing masks is going to help reduce the risk overall. Certainly, social distancing. I think that's going to be harder to do in this day and age, just because of the number of people who have been vaccinated and where schools are in that journey. I would also say I would hold out hope that Pfizer or Moderna, but more likely Pfizer, I think, in the studies will have a vaccine that has got an EUA for younger kids by the time we head back to school.
Yeah, I would agree with all of that, especially that last part. The way we've seen the expedited process of data collection, analysis, and then approval, I have to anticipate that within the next 6 to 8 weeks, we will hear about pediatric vaccination and it being probably approved or authorized for those younger age groups.
And Sharon gets the last question today. She wants to know, Dr. Stites, do you still mask when you were in Southwest Missouri?
Here's the deal. I was outside with family. We were all vaccinated, so I didn't have to worry about it too much. When I went in and out of the filling stations traveling, I did still mask. But that's because I went around a whole lot of people then, and it just made me feel a little less secure when I'm going into the restrooms or just being inside. So I did then. When we were down at the resort, we're really by ourselves, and it's kind of a place with cabins up in the woods, and you're way away from everybody else. So we felt pretty good. Then when you're out on the river, there's not a lot of people on the river but us, so that was outstanding. Hey, listen, I want to say thanks to all of our folks, but first, just a quick promo about tomorrow. We've talked many times. Oh, that's I got the wrong page of the script. Tomorrow, we're going to hear from some more young people. Boy Scouts from Troop 320 and Liberty and 180 and Gladstone earned merit badges during this pandemic by helping supply personal protective equipment to their communities. Heart to Heart International provided the PPE. We'll hear from Scout Robert Reese of Troop 320, Scout Jacob Kaler of Trout 180, as well as their merit badge counselor, Dan Reese. And Heart to Heart's Director of Operations, Dan Neal, talks about how this community support helped them. So proud of these young people. We look forward to sharing their story tomorrow. And we were so proud of our young folks today. Yes. So I'm just going to go around the horn here, and I'm going to do it kind of in a funny order. Natalia, I want to start with you. Final thoughts that you would like our listening audience and viewing audience to hear.
really get vaccinated because a lot of the theories that are online aren't really true. The vaccination does help.
Thank you, and well done, and you're dead on right. Good job. You get an A. Dylan, how about you? Final thoughts?
Get the vaccine so we can get back to normal.
I like that. Right, man. Yeah. Right on. All right. Josiah, final thoughts?
Get the vaccine, protect your family and friends so we can get back to normal.
All right. And happy Father's Day there to James. I even got it right that time. All right. Ashlyn Goldsberry, final thoughts?
Get the vaccine. It's worth it.
All right. Yes, it is. Yes, it is. Thank you. And Alice McConnell Curry, daughter of Sean Curry. Sean, happy birthday to you. Alice, final thoughts. Happy birthday. Happy Father's Day. Alice, final thoughts.
I'd just say that anyone who can get the vaccine should, because we all have to play a part in getting back to normal.
All right, you guys. Thank you all, each of you, for being on this program. You did a great job. Straight A's all the way across the board. And stay in school. Keep doing the right thing. Great choices. Thank you all for being part of it.
Yeah, I mean, such young, bright, and insightful guests we had today. You know, it is important. School is important. Kids being in school is important. Again, we've said this before. Safe places, places where they can eat, lunches, social interaction, all of those things are good. So we need to continue to be able to have our children be in school. And this past school year really seemed very long. I know at the end of all the school years, I think how quickly it's gone. This seemed very long, and I know for the kids, it did as well. The way that we can protect ourselves and continue to do in-person learning and have those positive experiences is through vaccination, protecting the kids with vaccination and all those adults in the school as well. So continue to endorse vaccination. I think this coming school year will be much better than the last school year. I had to do virtual learning for my recertification last year, and it was difficult, so I can't imagine what some of these young people, and with everything else they have going on, how they were able to function as well. So it is important that we continue to be able to have in-person learning.
Yeah, thanks again. Thanks. And listen, to all of you, I'm a little older here, so I'm probably the old man in the room. Just to say there's always great careers in healthcare, medicine, nursing, respiratory therapy, physical therapy, you name it, social work. And I need some people to help me when I get a little older. So make sure you think about that. Love having you all on here. You guys are a great team. Thank you so much. And to all of our audience out there, thanks so much for being a part of this program. We've heard from some great young people today. And remember, stay safe out there. Don't be part of the shed and spread. Get vaccinated. Show everybody how much you love them. We'll be back. We'll see you tomorrow.